Hey there, everyone. How you doing?
Morning or afternoon.
Afternoon, afternoon. Awesome. It's just at 1 o'clock right now for everyone. We'll wait just a little bit more. We got only about 20, now 30 some people on the call, so we'll just give it about 5 minutes and then we'll get started if that's okay with everyone. So this is a relatively short meeting today. See, for some reason, it's using my wrong camera here. See if I can switch that around.
Hey, Jessica or Kurt, just wanted to make sure that you'll notice that there is some AI note takers in the chat.
Okay. Um, Does anyone have any issues with that? Our only concern always is that, and I'll just mention to everyone right out there that um, keep things as need to know basis, and certainly understand if you are sharing information, you're volunteering that information. For everyone else, so remember that it is protected information regarding confidentiality for disabilities and things like that. So um, our concern with AI takers, I know you're doing that to help take notes, but um, I don't know what our policy necessarily is on that, but everyone needs to understand that in this community that is HIPAA protected information.
Thanks,
Hi,
Kurt.
Amanda.
Yeah, I just wanted to add that yes, we cannot have AI note takers
Oh,
in our rooms, and specifically exactly what you said. We don't want any information to get misshared, things like that. So rest assured, though, we have McKenna going through and removing those as we see them. So apologies for that, but we are removing those if we see them. But thank you, Savannah, for letting us know.
you appreciate that. And I know a lot of times I had it where it automatically started doing it for me, even though I never signed up for it. So, um, all that came in handy. It was a little frustrating, and it took a little bit to get it off my information there with AI. All right. 102, we'll just give it 103. We'll just give it a little bit more time here and then we'll get started. Is Bobby here? Bobby, are you here yet?
I am. I'm here. I'm ready
Yeah.
to rock and roll whenever you guys are.
All right. All right. Hey, Bonnie. Welcome, welcome. I haven't talked or seen you in a while.
I know. I appreciate the invite.
Oh, you bet. You bet. So, well, we'll do a little bit of homework first before we jump into you. And let's just kind of start with everyone. Um, Very open forum we have. We want to make sure everyone understands that things are transcribed. And you might notice here we've got our new, thanks to McKenna, that we've got this nice slideshow way to kind of keep us on track here and keep us on task. The minutes are always posted on the website. Um, Basically, I just mentioned earlier, refrain from sharing that protected information. Also identify yourself, especially if you're just on the phone, so we know who's talking. And then, of course, everything else regarding that and maintaining muting when needed. I will try to keep things one at a time and call on you if you do need to talk or want to say something. Something as simple as saying you want to be in the queue or put that in the chat box. We will then call and keep things on task. So basically, everyone, and I just want to remind everyone, I know things get pretty passionate sometimes here. Please don't confuse passion for anger. We wanted to make sure we share, and it's okay to be passionate about it. Just don't take any personal offense to people just trying to be direct. And also, we'll try to keep that in mind as we move forward. All right. So, starting with everyone else, I just want to share that reminder that everyone, as you can see on the screen, if you're on the screen, *6 to come off and mute. We will call on you, or if you want to raise your hand, that helps as well. And then we go from there. And with that, I think we're right at that point where we can do some roll call for anyone who is on this call by phone and have not logged in And then Jessica, are you going to do the new members roll call as well again on the cert?
So McKenna's actually gonna do it
McKenna.
after all. So
Sorry. Okay,
we'll do that
McKenna.
right after the phone in, folks.
Okay, so if you are not logged in through Zoom and you made a call by phone and are on the line, please let us identify yourself so we give you credit for being at this meeting.
Kurt, this is Cheryl Hargett Dorset. I am here.
Hey, thank you, Cheryl. Glad to hear you here. Anyone else here? I know there's a lot of things going on at the same time here, but anyone else? Okay. I think, Bobby, you got anything you wanted to add before we get into the next step of the program here?
No, thank you. I'm just here to talk about budget stuff. So when you guys are ready for me
Oh,
to
I'm
do
sorry,
that,
Bonnie. Bonnie, we have a co-chair. Her name is Bobby
I
with a B.
apologize.
Yeah. Bobby Christensen. I thought she was going to be here today, but I haven't seen her on the call yet. And she sometimes gets caught up, I know, in traffic and things. Okay. So you see, we have the first time attendee poll up on the screen right now. Basically, if you've never joined this meeting before, if you can log in here, click on it that just got opened up here. Just fill this out. That way we know you're on the call. That way we know you're registered for voting. So if you are a first-time member, please feel free to fill that out. And we'll just give a minute or two to make sure we do it. Really helps us track because we will eventually be doing some voting again on some policy procedures that we want to maybe submit to the state. If anyone wonders what that's for, we've been doing that for quite a while. Okay. I'm going to get mine off my screen. I don't need it. Okay. All right. We got that. We just allowed a little bit of time for that. If anyone wants to jump into that, but I don't have the next part of the agenda up. I think, do we go to open forum after this?
Hey, Kurt, this
Yes.
is Jessica. We do. I'd like for McKenna to just jump in really briefly to share the phone number for our team in case those who are calling. I know we only have got Cheryl. I don't know if anyone else joined, but it's helpful to share in case anyone wants to provide
Yeah.
these voting or poll results over the phone to us directly. So McKenna, do you want to come off mute and just read out that phone number?
Yeah. Thanks, Jessica. Our phone number is 303-866-5638. And I'll also put that in the chat.
You also might put the toll-free number.
And I see you guys, I'm assuming that you can call this number and actually get to a live person when you call it in eventually.
Yeah, that's a direct number to the department. So Cheryl, we can look into whether or not it's toll free and then definitely share, excuse me, a toll free number if that's needed.
Okay, sounds good. All right. All right. Open forum. And then we've got some news coming down from the state. Everyone's heard about the budget crisis and some changes that are popping up here. And that's why I do want to start with, we've invited Bonnie Silva here. Hey, Bonnie, if you guys don't remember her from a while back, she's always been pretty involved in this. And maybe, Bonnie, you can introduce yourself and share a little bit of what our insights are on this PDPPC budget.
Sure. Thank you, Kurt. I appreciate it. So for those of you I haven't had the opportunity to meet, my name is Bonnie Silva, and I have the honor of serving as the director of the Office of Community Living here at Healthcare Policy and Financing. I actually used to facilitate the PDPPC, maybe circa 2012, so more than a decade ago. So this is a meeting that is near and dear to my heart, and I appreciate having the opportunity to come and be on your agenda. As I am sure you may have heard, Colorado is facing a bit of a fiscal crisis. And Medicaid, given that we are 2/3 of the state budget, has really been asked to come to the table to help solve it. So I'm here today to give just a high-level overview of the reductions that are being proposed, specifically from the Office of Community Living, and certainly take some space and time to answer any questions that you all might have around those proposals. So, at a high level, I think it's important to understand that we're kind of sandwiched between two fiscal problems. The first fiscal problem is that with the passage of the federal bill HR 1, there were tax cuts in that bill. And because Colorado's tax code is tied to the federal tax code, it meant an immediate reduction in our state revenue. So that is why in the summer, you saw us host a special session with the legislature to come back into balance. And the balanced budget is not required in every state, but it is required in Colorado because we have what is called the Taxpayer Bill of Rights, or TABOR. And that law requires Colorado to have a balanced budget. So there were actions taken this summer, including some OCL long-term care specific actions to help us, immediately fill that $1.2 billion revenue hole. But outside of that, Colorado has a structural budget problem. Our general fund dollars are growing at a rate of about 5.5%. The TABOR cap is growing at 4.4%. And then here comes Medicaid, and we are growing at about 19%. So the math doesn't math, and we have to do our work to bring our trend back down closer to what how the state is growing in terms of the funding that's available. If we don't do that, it means that we will take money away from other state agencies, such as the Department of Public Safety or Education or Revenue, right? Like, as a state, we want to have a robust economy. And so I think the other backdrop that is really important for you all to understand is that you will see us making reductions and changes as quickly as possible. And that is because the faster we are able to generate savings for our state, the less savings we need to seek, the less deep reductions we have to make. And so time is of the essence here, which is never a good spot to be in. So with that backdrop, I am going to ask that the team maybe link in the chat to our Medicaid sustainability webpage. What we have created within the Office of Community Living is a landing page, and on that landing page we have links to every single proposed reduction that is out there, and a fact sheet for them. So if you want to dive deeper, you can. I am going to be moving kind of fast and at a pretty high level. I'm not going to go super deep on any of these, but want you to have the sort of resources to find out more should you be interested. I also hosted a webinar on the 10th that I believe is also posted on that webpage. So if you want to hear me talk about them, Godspeed. I wouldn't want to hear me much talk about them, but sometimes the context is more helpful than just reading through the fact sheets. You also have that option. But with that, I'm going to dive into sort of what we are looking at doing. We have 18 actions that are being proposed. We have, and you'll see it's across programs. So we have a reversion of nursing facility funding that was dedicated for nursing facilities to help support higher payments for staff. We are reverting those dollars. The 1.6% across the board rate increase that last session the legislature allocated, that is being reversed. So that money, October 1st, so it was implemented July 1st, October it was taken away. That's going to go back to the legislature to help us balance our budget. We have a service called Community Connector. It is available in our Children's Extensive Support Waiver and our Children's Habilitation Residential Program waiver. This service has grown by 620% over the past 5 years. We have kind of stair-step different actions to try to make sure that authorization and spending is in alignment with our payment and program policies. And so the actions we're taking is where we can see where the authorization or payment really wasn't in alignment. So we're actually reducing the rate for this service by 38% in totality. The reason for that is when we look at the analogous service in the adult world, we can see that we're paying way too high for this children's service. So we're bringing that down. We are also limiting the service to school-age children and above. It's not that children younger than school age don't need help accessing their community, but that most often when they do need help, it's not because of their disability, and rather it's because of the fact that most kids under school age need a significant amount of help in accessing their community. And I'm certainly not minimizing the additional challenges that might come with having a kid with a disability, but we are really trying to be more proactive in separating out parental responsibility versus what Medicaid should pay for. We are also reducing the amount of units that may be authorized for that service. So you can see us taking several actions there aimed at making sure that that critical access to that service continues and we can kind of live within our cost envelope there. We are also looking at so in many areas, when we look at what is driving the increases, it's, first of all, the biggest bucket is rate increases. The second is utilization. So same people utilizing more services. The Community Connector is a really great example of that. And about 11% is enrollment. And where we see that enrollment trend really being driven is in adult waivers that support people with intellectual and developmental disabilities, so our developmental disability or DD waiver program. So we have a series of actions aimed at stymieing the growth around enrollment while not stopping it. So you can see that we are going to right now, if a child or youth is enrolled in the CES or CHIRP waiver, they have the option to request enrollment into the DD waiver based off being enrolled in those children's waivers. We are going to stop that automatic enrollment process, but rather keep the ability to enroll people who might meet a set of emergency criteria. We don't want anybody moving into crisis. And so, maintaining our ability to mitigate that will be important. We're also maintaining our ability to enroll youth from the foster care system and individuals who are wanting to transition from the institution to the community. So a lot of difficult changes there, but we are again trying to make sure that we continue to allow enrollment for those that need it the most. There's also a waiting list for that residential program, and right now every time somebody moves out of the waiver, we move somebody off the waiting list. We're going to slow that down a little bit by 50%, so 2 people off, 1 person on, again trying to have a measured approach here. We are also changing in the same DD waiver. There is a program called Individual Residential Services and Supports, or IRSS. We have family caregivers that in some cases have been paid a higher rate, and there's a lot of confusion around sort of why and how that happened. The department owns that we're part of that confusion. The goal here is to make sure that that higher rate is paid when in fact the agency is bringing in staff to provide care, and so it's more expensive to render the service, and that the lower rate is paid when it's mostly a primary caregiver, whether that's a host home or a family caregiver. So we're moving forward with that. Let's see, we are also looking at we were going to move forward with a presumptive eligibility process with CMS. Because of all of the government shutdown and things that are happening there, they are going to delay their review of our presumptive eligibility. Basically, it would allow us to move people out of the nursing facilities before they went through the entire eligibility process, or from hospitals straight into HCBS services. So we're going to take the funding that we would have used and we're going to send that back to the General Assembly and say, use it to balance our budget. Our intention assumption is to still move forward with presumptive eligibility, but this is an easy sort of cost-saving measure. We are also adding back to the DD waiver. So in all of our residential programs for long-term care, you can take down the slide deck. I prefer to see faces if that's all right. For all of the residential programs, there's what's called like a patients have to pay for members have to pay for a portion of their care. It's called petty, and we're applying that to the DD waiver for whatever reason that hasn't been applied, and so that will help us again balance our budget. We are going to implement a soft cap across certain HCBS services and long-term home health services. It is personal care, health maintenance, and homemaker, and making sure that, again, we looked at what does our data show on average what people are getting, and how do we come up with a really, really generously reasonable soft cap. We don't expect it's generous in a way that we don't expect that everyone will just automatically be approved for that cap. And we really want to make sure that it's based off of assessed need, but this allows us to again be more proactive in ensuring that services are authorized in a way that are in alignment with our policies. We are also looking at doing a cap on the weekly hours a caregiver can render, a single caregiver can render to a single person. We're looking at capping that at 56 hours a week. And then the cap that is already in place for a caregiver, that's 16 hours a day. So no matter how many people they're providing care to, it can't be more than 16 hours a day. And then for a single person, it can't be more than 56 hours a week. The goal there is to make sure that we're incentivizing the development of a robust workforce and that we don't have over-reliance on a single caregiver to render care, and also come up with, reasonable ways to ensure that we can continue to pay for these critical services, but in a way that we can afford in the longer term. We are also looking at reducing for legally responsible people, so the spouse, parent, the amount of homemaker services from 10 hours to 5. Our rate methodology said that we were paying way too much for movement therapy, so we are going to take that recommendation and reduce the rate there. We were set to implement equine services. We never fully implemented it, and goodness, it is a lot easier not to give people something than it is to take it away, so we are just not going to move forward with implementation there. And I'm trying to think. We covered that one. Sorry, friends, I'm just going over my list really quick. We are making a series of changes to how services can be billed for. So we are establishing a per diem rate for private duty nursing. This is specifically for people who are receiving 24/7 PDN, and it will be a blended rate that combines CNA services and RN services. And we're really hoping that the reduction in administrative burden will offset the reduction in the rate that will sort of correspond with that. We're also requiring 15-minute units for long-term home health and 30-minute units for PTOT, speech and language. Right now, a single unit is like up to 2.5 hours. And when we look at how the services are actually delivered, it's much closer to 15. This doesn't stop people from billing more than one unit, but it does better align our payment methodology with how services are delivered. And then we are developing group rates for certain community first choice and long-term home health services. And this is personal care, IHSS, homemaker services within CFC and CNA. And this just means that if you're a singular caregiver providing services to 3 people, you would build a group rate. There's some administrative efficiencies there. It's a pretty typical practice for state Medicaid agencies to have group rates, and so it's aligning our policies accordingly. We are developing a standardized tool for negotiated rates to better reflect that for our children's habilitation residential program. And I think that is it. That's a lot. But I'm going to pause and see what questions you all have for me. Again, link to the webpage, the fact sheets, but I wanted to high level say, what are we doing? Why are we doing it? And then certainly I want to hear from all of you.
Well, thank you, Bonnie. That was a lot. I'm sure there's a lot of everyone understood exactly 100% of what you just said. So let's say if anyone has any questions, why don't we just open the floor up? You can raise your hand. You can put your name in the chat or just say you want to be in the queue. So let's kind of start with there. Anyone have any questions? I don't see any hands, although I don't see the whole screen. But I'm wondering if anyone has any questions for Bonnie.
This is Cheryl Hargett Dorset in the queue.
Sure. Okay, Cheryl, go ahead.
I'm not sure if this is related to her framework and her topics of the budget, but I would like to propose for open forum, since our authorized reps are taking on so much more time and work to represent us, that we put that forward for a vote for them to be somehow compensated in our budget.
Okay, I think as a good forum item, let's make sure we include that in a.
It hasn't been discussed in quite a while.
Yeah, I think we need to put that as an option for a future agenda item, but I think there's some good ideas maybe to approach that moving forward.
Okay.
Thank you, Cheryl. Anyone else? 'Cause I know I have a bunch of questions.
This is Jim Boyce. I have a question.
Sure.
So, can you, for this meeting, you went through a list of things for the people that are calling in this meeting, people that are on CDAS and things like that. What specifically are the changes that we can expect?
Yeah, it's a really great question. I went back and forth on, do I just talk about things that are specific to CDAS or IHSS, or do I give you all the overarching view? And I opted for the overarching view. But I think that what will impact people on CDAS is the reversion of the 1.6% rate. That's already happened. So you all have already seen that impact. Depending on how your services are authorized, if you're over the proposed caps for personal care, homemaker, and health maintenance, there may be an impact on you. And I want to be clear, like it's an annual cap at approximately like 19,000 units or 13 hours a day for HMA, 10,000 units for personal care. It's like 6.8 hours a day, or 4,500 units or 3 hours a day of homemaker. We will have an exceptions process in the very rare circumstances that your needs, appropriately exceed that. But it could be that, there would be a reduction there. If you have a singular caregiver providing your care for more than 56 hours a week, there could be an impact there in particular. And if you have a legally responsible person providing homemaker services, there might be a reduction there as well. Those are the key ones I'm going over that I think are very specific to CDOS and IHSS, where there could be an impact.
Thanks. That's great. Where can we find those cap numbers?
Yeah, so they're on the link that's in the chat. So we have let me just add, there will also be group rates once those are developed. Those won't be developed for some time. That might also impact. But all of these fact sheets are on our OCL LTSS sustainability webpage. And if you go to the soft cap fact sheet, it's all listed out there for you to see. And then I don't know, Aaron or others, if after the meeting, if a link can be sent out, maybe somebody's driving and they don't see the link now, they can get it later. They're shaking their heads yes.
Great. I have a couple go ahead. Anyone else?
No, Kurt, can I move forward real quick with my two more questions? This is Cheryl Dorset.
Sure, Cheryl.
So, with regards to the impact on the CDOS program, will these exception processes be included in the nurse review? And is that forthcoming if the review is not into 2026, or is that immediate right now?
So the exception process has yet to be implemented. We will be working over the spring and summer to fully implement these changes. And it will happen with the case manager and the department. So that is how it will be implemented. That's currently how we implement all exceptions processes related to HCBS. So if you have happened to be involved in those before, it'll be very similar.
Yes, we have, but again, I think I heard you correctly saying this won't be implemented until spring or summer.
Correct.
Okay, thank you.
Great question. Anyone else? Any questions out there? I do have a question that's been dying to ask people, and Danny and I have talked about it before regarding the homemaker category with a legally responsible person. How's that defined when on the CDOS we have budget authority and you can actually bill hours based on paying a higher rate, but bill less hours? So I don't know how you manage that limit
Yeah.
when we do the pay based on a rate of CDOS 1, 2, 3 or homemaker.
Yeah. We're not changing your ability to set the rate, so I think that's important. But we are capping the number of hours that can be authorized under all delivery options for legally responsible people. So if in fact your budget is, authorizing a spouse or a parent more than that 10 hours or 10 hours a week, you'll have to bring it down to 5.
Whoa.
Okay, I'm still confused. So you could technically have, per the new rules, 21 hours or 3 hours a day for homemaker, correct?
That is correct. Not all of
No.
which could be provided by a legally responsible person.
Right. So then could that legally responsible person turn in 5 hours or whatever it's going to be and bill at a pretty high rate? And number two, it's not technically tracked that way or required to be tracked that way with the FMS providers.
Yeah,
My caregivers turn in one rate. I have them log in at that rate for whatever they do, whether it's homemaker, or personal care, or health maintenance. Based primarily what I do. Understand what I'm saying there? So they just log in at one rate. They don't have to log in. In the old days, I know you remember this. It used to be they had to log in under the homemaker category separately, or the personal care separately, or the health maintenance. That went away quite a long time ago, and they basically log in at one rate.
yeah, that's a really great point, Kurt. I think that we'll have to take that back in terms of how we're implementing it and make sure that we're providing guidance and how it applies specifically to CDOS or not in that way.
Right.
So we'll definitely take that. I will maybe also flag for you, and I'm sorry, but I do have to jump. I'm
That's okay.
facilitating a meeting at 1:30. Erin put in the chat listening session. So if after hearing or reading about what we're doing, you want to come and provide verbal feedback, you can do that. If you can also link for people, we have a Google form. So if you have written questions for us, well, what we're doing, we didn't really have the opportunity to go out and say, what does everyone think we should do because of the fiscal crisis we're in? We really want to hear questions around how we should do it. And I think there's a opportunity to make sure that we're working collaboratively with all of you to get it right and make sure that, out the gate, you have the guidance you need to be successful. Or if there's something we haven't considered, that we make sure that we consider that in our implementation.
Right. Bonnie, I know you need to go. Does anyone else have any last questions for Bonnie?
I do. This is Cheryl Hargett Dorset. So, Kurt, I have to piggyback on your question because it's a really imperative question for those of us with our budget on all three categories or one category for all of the full care plan, health maintenance, personal care, homemaker. So if I heard correctly, that is still being looked at or considered?
Yeah, sure.
Yes.
What we'll do is we'll take the feedback in terms of how we're going to operationalize these changes in juxtaposition to the CDOS program. So I think that's the action item for us. But these are the soft caps that we have proposed to put in place. So I think more to
Okay.
come.
Well, I
Thank-
would like to add how keeping things within budget, condensed with one rate, simplifies our management of our care.
And
Thank you.
go ahead, Bonnie.
I definitely hear that, and that is our goal, is not to make things harder as we're looking at implementing things. So I just want to say thank you all for having me. I appreciate the opportunity to come and talk about this. I know it's a difficult time, and I look forward to sort of hearing your feedback now and sort of into the future. So I do have to hop. I appreciate all of you, and I hope that you have a good rest of the meeting and look forward to continuing to being engaged.
Thank you, Bonnie, for joining us. Appreciate it. You take care.
Bye.
All right, everyone. And I just want to throw in there before we jump on. I know we're trying to stick in our timeline. Um, Everyone needs to appreciate the sustainability that needs to happen. Um, Cutbacks are tough. There's no two ways about it, but it's better than nothing. And I think we need to understand that. I know personally, I dug a lot more into Tabor and what's happened, and there's a combination of things. I won't call it a comedy of errors, but there are issues that are going to be addressed, and I really believe in the next year or two we'll get back on track. Um, but basically, Reader's Digest version, everyone, the state did have a balanced budget as required by Tabor, and 4 days later, revenue got cut because of the bill. Not saying it's a bad thing necessarily, other than immediately the projected income to the state revenue budget went down after they already had a bill approved. So it's sort of like saying you're planning on getting $2,000 a month, and then guess what? You plan on spending that money, and you only get 1,500. You got to make up that difference somewhere. So that's the long and short of what's going on. With that said, we got the HICPUF Job Hub and CDOS Attendant Directory. We're running a little bit behind, but let's jump right into that. Anyone? Go ahead.
Thanks, Kurt. Hello, everyone. My name is John Hendricks. I am the Direct Care Support Specialist. I work on the Direct Care Careers website under the Direct Care Workforce Unit. For those of you who might not be familiar with the Direct Care Careers, it was born out of ARPA, and it was really envisioned to be a resource and job hub for direct care workers, direct care providers, and consumer direct employers as well. This, if you could go to the next slide, please. Thank you. It began, like I said, out of ARPA. It launched at the end of 2003, and we started adding
acronym, please. ARPA. What's ARPA?
ARPA, the American Rescue Plan Act.
Okay, thank you.
And we started adding trainings at the end of last year. So we've had trainings on there for almost a year now. We were beta testing those last year. So as it stands right now, we have almost 1,600 total candidates or direct care workers on the site. We have 139 employer agencies or employers. With 56 employer job posts. We have 36 CDOS employers, with 35 of those employers having job posts on there as well. We have resources available. These resources kind of run the gamut of where to find insurance, where to find daycare, where to find housing assistance if you're a direct care worker and you need those resources, but it also has resources for direct care workers in their role, like doing transfers from a wheelchair to a bed or things like that that they might not know or have available to them. We also have modules that were state developed, and so far this year we've had over 6,000 of those modules completed. Next slide, please. All right, so I'm going to go ahead and jump into a quick demo for you. I'm just going to focus on the employer side of Direct Care Careers website. So I will share my screen here. And Can everyone see my screen? Could I just get a thumbs up? McKenna, thank you for the head nod. This is the Direct Care Careers website. I'll drop the link here for you. Once you go to that website, you will be taken to this page. This is the demo environment. This isn't actually the live site, but it has all of the features that the live site will have. So you'd want to come, of course, to Colorado. And once you get to Colorado, you'll have the sign up page. If you're already logged in and have registered for Direct Care Careers, you can come up to this login up here, and we'll go to that here in just a second. You can sign in. There is a translation feature, and if you click on the English dropdown, we have the website can be translated into a few languages. But what I want to focus on right now is how to sign up. So if I were a CDOS employer, you could come to the caret over here on the right and have that drop down. And what we would need from you is to enter the employer's name. So if you're helping a CDOS employer to sign up, that would be the actual employer's name. And then you would need an FMS ID number. So an FMS ID number is just your PALCO or your PPL ID number. If you do not know that number, you can go up to the top here and you can see where it has PALCO login and the PPL login. So those will take you to those portals. And if you don't know your ID number, you can find them there.
Actually, John, no, they're not there. I've done this before. They have to give a call.
Okay, thanks, Kurt.
Just share. You bet. All right.
Yeah, I'll check on it. And then you can go to, excuse me, for the employee email, you can put in any email you would like the messages for the website to go to. It doesn't have to be a specific email. That's any email that you choose to use, and then your zip code. So basically, we ask for this information so we can verify that it's actually you, the CDOS employer, who is trying to log on to the site. So all of the employers, all of the CDOS employers, agency employers on the site are verified. So if I'm a direct care worker and I come to the site, I know that all of the job opportunities and job postings that I'm seeing are legitimate. So I am going to now just go into log in, and we'll continue. And this is what you'll see when you log in as an employer. Basically, there's some information up here and account details and edit my account. That just adds more information to you. You can put in more descriptive information. You can put a photo or a logo on there if you like, so that next to where it says Kendall Lewis, that little sort of placeholder image, you can put that information in there. And the more information you put into this website, the better, whether you're an employer or if you are a member. The reason why it's so important to get as much information as you can in there is because this site has what we call job matching. So there's an auto match feature. So a lot of the questions that an employer would put in here for a job posting are similar to those that a worker might put in as well when they're filling out their profile. We did that so that if I'm an employer and I come in here and I post a job, I will automatically be matched with people not only in my zip code or my area, but those people who can perform the types of services that I would need. We also have like times that folks can set that they're available or they need help. So that's kind of like the really short explanation of the My Workspace site here. Off to the side, we have jobs. So you can go and you can view all of the jobs that are posted, whether you're an employer or you're a worker, those jobs are viewable for you. We have our resources page, which I kind of already went through a little bit, but you can come in here, and if you're looking for a website or if you want a video or actual training, you can filter by those options and find the right resource that you're looking for. You can also use this keyword search. It works best for single words. Phrases, it doesn't really like that much. So if I'm in here and I'm looking for insurance, you can type insurance and it'll come up with all of the websites that have to do with insurance. The next, I'll go back to my resources page or my workspace. And some of you may or may not be aware, we did have a pretty big upgrade a couple of months ago where we updated our learning management system. So I'm going to take you into the Learning Center for a real quick look here. So this is the new learning management system, or LMS. We have a lot of courses on here. This was all of the courses that we uploaded for the original batch, all had to do with a universal worker model. So if I'm a new direct care worker, or if I'm interested in becoming a direct care worker, you can come to these modules and they'll pretty much go from what is direct care work all the way through how to communicate, how to work with members in the community, legal issues. There's also a HIPAA module, which is by and far our most popular module on here, because people have to get that HIPAA certification every year. When you complete a module, you will receive a certificate of completion, so that if I'm a worker or if I'm a CDOS employer and I'm looking at someone's job profile, I can also request to see what trainings they have completed as well. We are working right now on getting what we call badges. And so badges are going to be like if you completed a series of trainings that that had to do with one type of role. I'll just throw one out there like homemaker, then you'll get a homemaker badge. And so what those really are trying to do is make it really simple and really easy for people to kind of view a profile real quick and be able to see what experience they have, what trainings they've been able to do, and be able to match up together quickly and easily. We also we have categories in our training, and I want to go down to foundational skills. So these are sort of skills and trainings that are kind of outside direct care work, but are also things that you kind of would want to know. So there's how to collaborate, how to use support styles. There's also modules on here on how to build a resume and how to prepare for interviews. So sort of those life skills as well. And the last set of trainings we have in here are the career paths. Didn't quite get it. There we go. So if you're a direct care worker, or you're thinking of being a direct care worker, and you just don't see that sort of ladder of like what other avenues can I get into? What other jobs can direct care work lead to? Well, we have 5 career pathways that if you're a direct care worker or you're thinking of it, you can actually work towards in your career. So I'm going to go back to the dashboard, and I want to show you one last thing before I wrap my presentation up, which is our new calendar. So we have this calendar on here right now. If you go to the live calendar, it's completely filled up with trainings and webinars that have to do with dementia training, everything that I find on the internet that's Colorado based, or webinars from places like PHI are listed on there. You can come in here and it'll show you when the event is, a description of that event, and a link to the registration page. So I update the website with resources and new trainings weekly. So, and once you get in on the site, you will get notifications. You can change those notifications so you only get them weekly or not at all. But you will be reminded that there are notified when new resources are put up. There's a new job posting that's interested in you, or when new trainings are added. So this is Direct Care Careers website. Are there any questions for me at this time?
Open up the floor to anyone who's got any questions. Raise your hand or chime in, saying you have a question.
I'll just jump in and read what you asked in the chat, Kurt. You said, can John, you get this information out to CNA schools at nursing schools?
Yeah, we've done pushes to schools, to rural health networks, to all the nonprofits across Colorado. So we send this information out to those annually, I believe, to just kind of get the folks familiar with the website and educated on what they can and what it can do for them and what resources are available.
Cool. Anyone else? I'll just say personally, I have got on it, and I do like that. You get an instant match of so many people. You got to do the effort to make calls and get a hold of people and hire them. Bobby, I see your hand raised.
Hey,
Go ahead, Bobby.
John, I just have a thought. Is one of the places you contact vocational rehab?
I believe I've had a couple of conversations with vocational rehab, and yeah, so and we've discussed. I think they have a newsletter, if I'm not mistaken, if I'm thinking of the
Mm-hmm.
right one. Yeah, and they were saying that they were going to put information about the website in their newsletter.
Okay.
Yeah,
That's because I've gotten to work with some great people that had disabilities themselves, so it is a good opportunity to meet people that can do this kind of work.
yeah, for sure.
All right. Hey, James, I see you have your hand raised. Go
Yeah,
ahead.
I don't know anything about this organization. Can you tell me, I mean, what do you guys get out of doing this? Are you guys, how do you guys, what's your role? I mean, are you just collecting participants or what? How do you get funded and things like that? I don't understand.
Yeah, it was funded through the American Rescue Plan, and last year through the budget, we were because that was only limited to a certain amount of time. Um, when ARPA ended at the end of last year, almost a year ago now, and so this work was put into HICPUF's budget to be continued last year. And so, yeah, we're working on different ways to utilize funds and continue this work.
I just want to add one more thing. Um, for years on this program, we've been having a big issue is finding good caregivers, and it even got worse during COVID. So part of this was all kind of precipitated by having some type of registry and encourage more caregivers to get into the industry. So this kind of continue of that whole process and helping us find people every way possible versus, I mean, years ago, Craigslist worked just fine. I don't use Craigslist anymore, but just another way for you to advertise and find more caregivers and for self-direction. So sorry, I didn't mean to jump in there, but that was kind of whole the precipice of this in the beginning.
Yeah, thank you, Kurt.
All right. Any other questions?
Hey, Kurt, I do want to call. There's a question in the chat from Tracy Heister. Tracy's asking, question to John. Have they been able to correct some of the glitches in the modules? We started using them, and when they first came out, and many of the modules were glitchy.
Yeah, if you have examples of the glitches that were occurring, please send those in. I know some people were like getting kicked out, not being able to get certificates, all of those, especially since we've switched to the new LMS. And those were some of the reasons that we did switch to a new learning management system, was to make sure that those training modules were running a lot more smoothly, and also to because we were very limited with the things we could do with the former learning management system. Like we couldn't do badges the way we wanted to. We couldn't do a lot of things. So that's why we switched. So if we, like as I alluded to, we did make that switch about 2 months ago. So if you haven't been in there in the last 2 months, if you want to go in there and try out a training module, see if any of those if those issues have been resolved. We haven't heard of anything. The only responses I've received to training modules are that sometimes there'll be broken links in there. So we review those monthly to make sure that all of the work links and the quizzes in the modules are working.
Anyone else? And I'll just share that. I know when I got in this, our information assistance at CDCO was able to help navigate through that a little bit. And personally, I still have mine on. I get a notification every day, even if I do not have a new person. So it's kind of handy resource right at your fingertips to if you're looking for a caregiver, sign up for this. I think it's a good avenue in addition to your other advertising.
Hey,
Okay.
Kurt, this is Jessica. Just a quick time check, and that's a good segue because we have Consumer Direct queued up to go over their attendant directory.
Okay.
So if there are no more questions for John, we might move on to Carly.
Any last questions before we move on? Hey, John, thank you for joining us on that. I think there's a lot of great information here, and everyone out there, be sure to share that with other people that you may know. All right.
Thank you.
All right. Next up, Direct Care Attendant Directory, CDOS directory through Consumer Direct. I'm going to say, I'm assuming that's Kathy going to present on that.
Kurt, it's actually going to be me. So hi
All right,
everyone.
Carly.
Hi everyone. My name is Carly Christensen, and I am the INA or Information Assistance Lead here at Consumer Direct Colorado. Today I'm going to be doing a brief overview of our attendant directory. The CDAS Attendant Directory is a web page that's designed to assist members and their authorized representatives navigate the hiring process on their own. So you can find the CDAS Attendant Directory on our website. I will drop that link into the chat very shortly. When you visit the attendant directory, you will scroll down to the bottom of the page and enter your zip code in the Find Attendant in your local area section. There's a little magnifying glass that you'll click on, and it'll take you right there. From there, you can search through the many different attendant profiles until you find someone who fits your needs. You can connect with the attendants by clicking Send Message under their profile image. So that way it's kind of done through email and it's all there to get you set up. We do also offer information and assistance services, or INA services, that can assist and guide members through the hiring process. We are able to help navigate the CDAS attendant directory as well as other resources to provide one-on-one guidance with finding attendants. In the chat, you will find a link to our attendant directory as well as the INA referral form. I will also drop my email as well as our phone number into the chat for any questions that you may have. If you get to the attendant directory and you are needing kind of a walkthrough or some guidance, you can also reach out to us via the emails I'll drop in the chat or at our phone number that I will also drop into the chat. So yeah, that's kind of all I had for you guys today. Is there any questions for me right now?
This is Cheryl Hargett Dorset. I have a question.
Yeah, absolutely, Cheryl.
For those of us that are on the phone and don't do email, can you announce the phone number?
Yeah, absolutely. So that phone number will be 844-381-4433.
And will we be getting a direct person to talk to, or how is this connected? The call in?
Yeah, absolutely. So you will be connected to our admin. Her name's Serena. She's really great, and she can either connect you to me, or she'll be able to help you through the attendant directory or completing an INA form.
Okay, thank you.
Yeah, absolutely.
Carly, we do have a question in the chat for you from Kurt. It says, does this include attendants who say they are available to work for, available to work for others when they apply for a job through Palco or public partnerships?
Yeah, absolutely. So attendants are able to create a profile on our website as well. They just will go to the tab that says find a member. And from there, they can create their attendant profile. We have the steps to complete that on our website. They can also call in, and we are more than happy to help walk through that process as well.
I'm just going to jump in, Carly. One thing that I know public partnerships for sure, and I believe Palco do as well. When they people apply for a job, they can click on there that they're available to work for others, and they used to keep track of that. Part of this whole directory was set up that that wasn't always necessarily kept up to date. So maybe the questions more should be directed at our friends at Palco and Public Partnerships regarding if that is kept separately or if that's included in this website.
Yeah, that is something I can definitely follow up with
Yeah.
and talk to them
Yeah.
during the breakout group today or in one of
Yeah,
our upcoming
right.
meetings.
Yeah, I see because I see Stan's on here and Sue. So I know they used to have that. And actually I went online before and it jumps right back to this website. So I'm not sure if that's still available or not. So maybe that question was addressed to the wrong person. So my apologies there. Anyone else? Any other questions?
Hey, Kurt,
Kurt?
this is Savannah from Palco. I'm happy to answer on Palco's behalf for that. We have an internal kind of like the workforce that we also collect called PalCare. And so the information that we pull is for that separately. It doesn't feed into this workforce report.
Okay. So you do have that resource available separately. That's good to know.
Yes.
Stan, I know you guys used to have one as well. I don't know if you guys still have that or not.
Yeah, we do have a directory, but it does not connect to the CDCO directory. But that is a good suggestion, and like
Okay.
Harwood said, we can connect on that separately. Actually,
Fine.
we're meeting with CDCO tomorrow, so maybe we can talk about that with them.
There we go. Awesome. All right.
Kurt, this is Cheryl Hargador said I've been biting at the bit with all this buffet of information that's been given to us. With a couple questions that I need to ask if I could to anybody in healthcare policy and financing that's on this call.
I think we still have time. Who's our time monitor here? I think we're
This is
still good.
Jessica. I think we're sharing that responsibility a bit today. I think it's important we get to the physician attestation for children. We might skip the chat review. And I know we're lower on time today for breakout rooms. So Cheryl, can I invite you to either the FMS room or the IHSS room, depending on what your questions are, to ask
She's
them?
online. She's by phone, so I'm not sure she can join. Is there a way you join her?
She can.
Yeah.
We can put her in the room she wants to go
Okay, yeah.
into.
If you could do that, Cheryl, I think that makes sense. We want to kind of stay on time, and we do have that physician's attestation we need to get to. I know you had a question about that earlier this week, so I think we're ready to move on.
Can I address that question?
Sure.
So I have been for years and most recently informed by case management, Jessica, that the IHSS required forms for over the age of 18 should always be completed by a primary care physician. My son being traumatic brain injury was always addressed through his neurosurgeon. I have been recently told in the last year that he no longer needs to have that. Could you please clarify that to me if that's correct or not?
Perfect segue into what we're going to talk about. All right. All right, Amanda.
All right, thanks, Kurt. And thanks, Cheryl, for that question. I'll start with just kind of running through what I was planning to talk to, and hopefully that answers your question. If it doesn't, let me know. And I'm always in the IHSS breakout room. So feel free to join us and happy to chat more about that in there. So Thank you, everyone, so much for PDPPC Day. My name is Amanda Smith. I'm on the participant directed programs here as the IHSS policy advisor. I know last month we had this also on the agenda, and at that time we did not have any updates, but fantastic news. We do have an update for the policy memo that was recently published. So, just to level set a bit how we got here, during the implementation of Community First Choice or CFC, I can admit that I had some policy oversight to align what we have in rule for CDAS as it pertains to the physician attestation, where a member under the age of 18 is not required to have the physician attestation completed. So, with this publishing of this policy memo, this now aligns that language where members utilizing or interested in enrolling into IHSS or in-home support services do not require to have this form completed. So, being once they turn 18, we will need that physician attestation form. But just to align that language that if you're under the age of 18, it is not required. If you're over the age, yes. So that can be found on our memo series page. It was also included as part of our meeting materials. But if anyone needs a link to that now, thank you, Jessica. She just dropped that into the chat. And then for those on the phone, that should have came in your materials for this meeting. And if it did not, just let us know. Happy to see what we can do to get that information over to you. Cheryl, when we start there, Cheryl, does that answer your question?
Well, yes and no. It does answer my question because I did read the required forms now through IHSS. My son is not currently on IHSS until his review this next year. Is the form that I have been used to having the physician sign in and confirm information data-wise for his care, is that form going to still be the same or different?
It will likely be a little bit different. I would say the most up-to-date forms are on our Consumer Direct CDCO webpage. And so I would say let's take a second and get to our breakout rooms. I'm just taking a look at time. And Cheryl, if I could have you join the IHSS room, we could close this loop on this piece.
And how do I do that?
I will ask Jessica to help me out to get you over there. No problem.
Thank you.
Of course. Alrighty, if there's no other questions, I think we can keep going.
I think it's time to try to stay back online here. We had a little bit extra. Thanks again for Bonnie Silva for joining us. So at this time now, let's plan on getting to those breakout rooms. I see we only have about 13 minutes. Are we going to extend that a little bit by maybe 5 minutes, Jessica? Can we do that?
That's a good question, Kurt. I think that is up to the group, but I know some of us at HICPUF need to, we have a hard stop at the end of this meeting. And so,
well, maybe why don't we just plan on 2:20, and then if we have to, we could do it in the final open forum and bring that up into light into the next meeting. Okay, so I'm ready to go to breakout rooms when you guys are.
right. McKenna, do you want to launch the breakout rooms? Thank you so much. As always, this is accessible to those of you logged online through your menu. Just go to breakout rooms or select more. And then Cheryl, I will get you over into the IHSS room.
Thank you.
Renee, are you still with us?
Yes.
All right. Would you like to go into the members only room?
Yes, please.
I think that leaves just people who are logged online. So let McKenna know if you're having any trouble getting into a room. I'm going to head over to the FMS room. Thanks, everyone.
Everyone back. Sorry, I got myself accidentally muted there. Definitely a lively meeting, everyone. Bobby, you got anything to share before we move on? Hello? Hello?
My system doesn't want me to talk. It keeps muting me.
That's
I
funny.
think the meeting went very well. There was a lot to digest. So if anyone has questions, please email Kurt or myself. But I appreciate all the participation.
Awesome. And I'll just add, in the past, we've always voted on whether we're going to have a Christmas, I should say a December meeting or not. Um, right now, we've got a lot of little things happening out there. I think it'd be a good idea at least to plan on another short meeting in December. Any thoughts on that from anyone out there?
This is Cheryl Hargett Dorset. I concur and vote yes.
This is Renee Farmer, and I was all for that last year. And then I got meeting is canceled a couple of days before the meeting.
Right.
And
because
I'm
of
all for
mandatory
a
meetings.
meeting too.
Yeah, I think we have a lot more things
that-
happening, a lot of moving parts this year. So maybe I should
But-
rephrase it. Is there anyone who does
But what
not
if-
want to have the meeting next month?
I just got one point. What if they have the mandatory meetings staff again?
Say that again. Hey, Aaron.
Hi, this is Erin. Apologies, my camera stopped working. But so the last comment was, what if HICPUF has mandatory meetings? And so typically we're in the middle of joint budget committee hearings, and there's a lot of state meetings we have to do. So the schedule is not quite finalized at this moment. So there is a chance that HICPUF staff cannot attend in December. I think that's typical, that we're just not sure yet. So what we can commit to is communicating with Kurt and Bobby about what our availability looks like. And then, we need to be here to help with the meeting facilitation, like logging onto the Zoom. But there might be a way to do that. So we will communicate with Kurt and Bobby.
Hey, I have a question.
Sure.
I work with the ACL in Longmont. I have my own professional Zoom account. I am willing to set up the link and give it to everyone at HICPUF so that they can send it out if that is doable.
Thank you, Bobby. So we'll work on this. I know there's the planning meeting very shortly. We will talk about what our options are, but thank you for that alternative solution for the meeting. Thank you.
Okay, so everyone, as of right now, that meeting is scheduled for the 17th. Again, we do the third Wednesday in November and December, mostly for the holidays, let's face it. Things slow down. And again, I know at the department level, joint budget committee, and a lot of stuff's happening and will happen a lot more this year. So I know there's a lot of involvement there. So, but hopefully, and thank you, Bobby, if we could do that, that'd be great.
Hey, Kurt, this is Cheryl Hargett Dorset. I'm hoping that there's still someone here from HICS that can answer something I don't think that's been covered since July.
Sure, what's up? Be quick.
It's with regards to the difficulty of care private letter ruling. Has that been passed?
Oh, I know we were hoping for an answer this month, but I'm not sure that's went through. Aaron or anyone, have you heard anything come back from the IRS on that?
This is Erin. We have not received notice back from the IRS. We're still waiting on a decision.
So is it possible we may not hear until the forthcoming new year?
This is Erin. I'm not sure. I think with all that's going on at the federal government level, I think we're hopeful that we'll get a response back, but we've been waiting for months at this point. But I can definitely check in with the CFC team who's managing that, and let them know that PDPPC would like an update.
And I
And
do
I only
know,
ask, Aaron, because on my FMS statements, it's showing my difficulty of care tax deduction being withdrawn.
that shouldn't have changed.
It did.
I would talk to your FMS regarding that.
Thank you, Kurt.
Yep. So, and to be fair, the IRS was part of the government shutdown, so I'm sure there's a lot of issues. Hopefully things get sorted out moving forward. So, one more thing I did notice, and Cheryl did mention it, Jessica and whoever sends out the newsletter, my phone number and email address, and I believe Bobby's phone number and email address have been omitted. I know I'm still on the website. Maybe it's just an oversight, but I have no problem sharing that stuff with anyone.
Great. This is Jessica. Thanks, Kurt. We'll take a look at that again.
Okay, good. All right. And with that said, we are just about at the end here. We caught up pretty nicely. Any last things before we call it a day? Any open forum items, last issues we want to make note of? Now's your last chance to kind of move forward with that in the next months coming forward. Okay. And same thing, Amanda, thank you. I hope everyone does have a great Thanksgiving and safe holidays. Make sure be safe. Eat my portion because I don't need any more. And with that said, we'll call it a day, everyone.
Thank you.
Thank you.
Thank you.
Bye
Thank
now.
you.